Good afternoon, Chairman Brady, Ranking Member McDermott, and other distinguished members of the subcommittee. Thank you for the opportunity to discuss OIG's work related to Medicare oversight and reducing fraud, waste, and abuse. We have a lot of work in this area. Today, my statement focuses on our recent work related to improper Medicare payments and billings and oversight of Medicare contractors. CMS needs to continue to take steps to reduce improper Medicare payments and improve its oversight of the various Medicare contractors. Improper Medicare payments cost taxpayers and beneficiaries about $50 billion a year. In recent work, OIG has identified millions in improper payments made on behalf of persons not entitled to Medicare, such as incarcerated, unlawfully present, deceased, or entitlement terminated individuals. While some progress has been made by CMS in these areas, it needs more accurate and timely information to trigger payment edits and better procedures to detect and recoup these improper payments. OIG has also uncovered extreme prescribing patterns by hundreds of general care physicians and questionable billings by thousands of retail pharmacies. Medicare also paid millions for prescriptions from unauthorized prescribers such as massage therapists and athletic trainers. This is especially concerning in light of OIG's increasing investigations into drug diversion. Verification of prescriber authority, edits, and enhanced monitoring are necessary to safeguard Medicare Part D and ensure patient safety. Recently, we have also reported improper payments to hospitals of millions of dollars related to vulnerabilities we identified as part of our nationwide hospital compliance reviews. In addition, we found that Medicare could have saved about $638 million over just a 2-year period by establishing a hospital transfer payment policy for hospice transfers and strengthening billing requirements. OIG has made specific recommendations to reduce these and other improper payments, but those steps alone will not adequately safeguard Medicare. CMS must continue its efforts to improve its oversight of Medicare contractors. CMS relies on contractors to administer various parts of Medicare, including claims payment, identification, and recoupment of overpayments, and benefit integrity functions. Our work has identified vulnerabilities associated with CMS's oversight of contractors. First, CMS has not fully leveraged data to improve oversight. Part C and Part D plans report fraud and abuse data on merely a voluntary basis. CMS does not mandate such reporting. Under this system, we found that less than half of the Part D plans have actually reported fraud data, and reporting varied significantly from plan to plan. In addition, CMS has made limited use of the data it has received in overseeing Part C plans and has not fully used reported fraud and abuse data for monitoring Part D. As a result, CMS is still missing opportunities to discover and alert plans and law enforcement to emerging fraud and abuse schemes. Second, we have found that while CMS's performance reviews of Medicare administrative contractors, or MACs, were extensive, they were not always timely. If performance reviews are not completed and performed timely, the information they contain may not be available to support future contracting decisions. To improve contractor oversight, we've made several recommendations to CMS that are included in our compendium of priority recommendations on our website. While my testimony focuses on our work to help CMS improve program operations, I would like to make a request that would help OIG better meet our growing oversight responsibilities. OIG is responsible for oversight of about 25 cents of every federal dollar spent. But our mission is challenged by declining resources at a time when our oversight responsibilities are increasing. By the end of this fiscal year, OIG expects to reduce Medicare and Medicaid oversight by about 20%. During the same time, 2012 to 2014, outlays for Medicare are expected to grow by about 20%. To ensure that we can continue to provide needed oversight as these programs expand, we ask for the committee's support of our 2015 budget request. In summary, we remain very committed to carrying out our responsibilities in the area of improving Medicare oversight to reduce waste, fraud, and abuse as comprehensively and effectively as possible with the tools and resources we have available. Thank you for your interest and support. I would be happy to answer your questions.